Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic as it impacts us here in the Appalachian Highlands. This is for June 14th, 2020. As you know, I like to follow deaths per million because that is a pretty good measure of how impactful a pandemic is in any given area. So if you go to Worldometer and you hit the US, then you go to deaths per million. What we did when we first started a few months ago was we created a chart that showed all 50 states. At the time, Virginia and Tennessee were almost vanishingly small compared to New York and New Jersey. We followed it every week since then, such that over the last few weeks, New York has increased 70%, Virginia has increased fivefold, and Tennessee has increased threefold. In another PowerPoint, I showed you the cumulative death rate in the United States. How fast are the total number of deaths increasing? In the first couple of weeks we were following it, we were seeing about a 25% increase. That is a quarter. So if it had been 100 deaths, it would be 125 the next week. Then it dropped down into the teens, then into the single digits. And then last week, it was a little less than 5%. So we're seeing a slowing of the growth rate of deaths in the United States. And we see a similar pattern in Virginia, though Virginia seems to be a bit behind the rest of the U.S., growing rapidly in the beginning and then slowing into the 20s and then the teens and then single digits the last couple of weeks. Tennessee is a little bit different in that I think because the numbers are so much smaller, the death rate has hopped around a little bit, still looks like it's holding in the mid-teens. So we have to wait and see if this is going to be a trend that continues or whether Tennessee, like other places, will start to slow down in the cumulative number of deaths. We expect, however, both Tennessee and Virginia to continue to rise. So far in Tennessee, we've had almost 30,000 diagnosed cases and almost 500 deaths, mostly, but not all, in the large urban areas. In Virginia, we've seen about twice as many cases and about 3 times as many deaths, again, largely but not exclusively in the urban areas. The question has been asked several times, why does Virginia have only twice as many cases but 3 times as many deaths? And that's largely, I suspect, because they aren't testing as much as Tennessee is. In the Appalachian Highlands, we've had almost 5,000 diagnosed cases and 150 deaths. So we're in the midst of evolving pandemics that seem to be growing at slightly different rates in our 2 states, and we'll have to follow to see what happens over time. If you're interested in more information, please go to the College of Public Health website on the COVID information resource page. There's a lot of other short videos. On the other hand, if you have any questions, please let me know. I'd be happy to try to answer them. Thank you very much.